This is just the beginning.
Welcome to Axios' very first live virtual event. You're living an experiment with us. Usually we do physical events, 60 or so a year. This is our first one during the virus to be able to bring our journalism live to you. Like we're living in the same virtual remote world that you are. Almost all of our employees are working from home. We're obviously adjusting our business to the new reality. We are testing this event series. We're doing it. We have 3 people, no more than that, in a room at any time. Our camera people have gloves on. Everything's being disinfected around the clock. I'm here with Sarah Fisher, one of the smartest reporters that I know. You cover media for us, but also mainly how people consume and disseminate information, which is obviously one of the most important currencies right now.
It's a hugely important currency because this has been called by the World Health Organization an infodemic. And I want to introduce also as well Mark Penn, who's the chairman of the Harris poll, as well as Stagwell Group, who's here to take questions with us. And I thought we could just kick it off by asking Mark a few questions about his most recent poll. Hi, Mark.
Good morning.
You had a great poll that you did for us where there were 2 waves. You took some answers from people last week, and then you took a few answers from people just yesterday. And what we found is that people are largely becoming more aware of how serious this virus is. More people say they're afraid to go to the grocery store, to coffee shops. What's your take?
Well, as you can find at harrispoll.com, we've done 2 waves of about 2,000 Americans. And what we really see is, in terms of behavior, a really dramatic increase in people unwilling to go on airplanes, unwilling to go to restaurants, unwilling to go outside for virtually anything other than perhaps grocery stores, for which they make an exception. So you can really see, while the levels of fear were very similar, about 22% believe that they might catch the virus and die from it. That fear level remained constant. Their behavior level changed very significantly, where a tremendous numbers of people now stop doing a lot of group activities and going to a lot of stores and other places.
We have thousands of people joining us on Facebook, on Twitter, on YouTube. You can follow us at hashtag Axios Events to ask questions, of which we can also pose to Mark. Mark, you've been through crises before, and we try to be very clinical in our coverage here, not be hyperbolic. It's hard not to look at the set of facts before us in terms of what's happening to the economy, the number of industries that say they need a bailout potentially just to survive, the number of people who are losing jobs. The jobless numbers just came out, and you're seeing a massive spike already. You've got J.P. Morgan and others saying that growth in the second quarter will be negative by up to 14%. You have deficits looking like they'll soon hit $2 trillion. This is a type of crisis that I think everyone who's living through it, it's something you're going to probably remember for a lifetime. In the data, what are like the early feelings that people have about the overall significance of this on their life and their country?
Well, I think that the most important thing is, what are people willing to happen here? I think that they've shown that they're willing to take the extreme measures necessary to slow down the potential spread of the virus. I think there's been no question about that. Very large numbers approve of the government policy. But if we also ask them about the need for stimulus, 80, 90%, whether it's a payroll tax cut or a check or low interest rates or bailouts, basically their attitude is, you better do something. In fact, the second biggest change in the poll was the percentage that thought the government was doing enough relative to the economy. And up dramatically went the percentage. Now most people think the government needs to do more, and they approve by 80, 90%, basically everything that you're hearing about. So as I say, remember, right now there's a bunch of healthcare professionals who really don't know much about the economy, and a bunch of economists who really don't know much about healthcare. And both of them are trying to drive their own policy boats. It's going to be up to leadership to resolve those two. And the public so far, I think, has actually gotten more supportive of leadership in the last week, more supportive of the actions from governors and the White House than they were the week before. So that part is good, but there are limits.
Mark, you mentioned that more people support the information that they're getting from the White House in particular. Are you seeing that both from Democrats and Republicans? Is that a bipartisan sentiment?
Well, it's almost bipartisan in the sense that, well, when you ask where people are getting information, obviously they're getting it from national news and other sources. In fact, they're getting it from virtually everywhere. But what we really saw between wave one and wave two was a big spike in people getting information from the White House, an increase in trust for the White House, but a partisan split where I think in the high 80s, Republicans believe what's coming from the White House, and 40% of Democrats believe what's coming from the White House. So there's a big partisan split, but that actually is the best partisan split I've seen for President Trump in the last 3 years, because usually no more than 10% of Democrats ever believe anything that he says. So he's up to 40%, which is much closer to a national consensus than he has ever had on any issue before.
Mark, you've advised presidents in the past. You're an expert on public opinion and how sort of the human mind works in thinking about people and thinking about crisis. What would your advice be based on what you're seeing in your data to President Trump? Obviously, it was a rough start with lots of misinformation flowing from the federal government, a very slow start. It does seem like the last week you see the president front and center. You see daily press briefings. You see an acknowledgement of the reality, and you see a springing to action. What else does he have to do to sort of reassure the public and restore credibility with a big chunk of the country that didn't really like him to begin with, didn't trust him to begin with? Is it possible for him to get above 40% with Democrats, or is that about as high as it can get given the deep feelings people have about him?
Well, he's getting 57% in terms of trusting him overall on this. Look, I think he had a weak start, even though I think he's right that he did slow down or stop, the travel from China. And so that wasn't an important element. But where people really are in a crisis is they need leadership to lead, which means explaining to them what's going on, explaining to them what's going to happen, and then those things that occur be in line with that. So the president says, we're going to be here for a month or 3 months or 5 months, and says different things on different days. That is, in any crisis, what creates a lot of problems and issues. If you can say, I've got a strategy, and I've got a strategy for the economy, and I'm going to resolve those two, and we're going to do what's prudent for healthcare and for the economy, and this will be over in 90 to 120 days. If he can be strong, definite, that's what leadership has to do. It has to keep the country together, right? Regardless of whether the markets go south. Right now, I'd say on the basis of public opinion, the country is more together than not. They believe in what has to be done, and they're doing that.
Mark, we're finding from your survey that there's a lot of hysteria that's happening right now, and people tend to believe that the media is the cause of that hysteria. 79% of people from your survey say that drastic headlines about how society is changing is what's causing fear. 78% of people think that news and images of people fighting over products at grocery stores is causing fear. You're somebody who's worked with the media over your entire career. What would you say to the news media right now to ensure that they're doing a good job of informing people but not causing panic?
Well, put things in context. In this poll, most people think this will be over in 4 months. Most people think 78% that they're not going to be affected. 22% really think that they could be deathly affected. Keep it in context. Look, it's true that the shelves are empty. So a lot of what is generating fear is true. There is hoarding, there are empty shelves, there are supply chain difficulties. I can't fault the media for reporting the truth, but they do have to be sensitive that the larger picture here is there's no, in the past, there's no rioting, there's no breakdown of civil order, whether somebody's fighting over a loaf of bread, magnitude so much lower than what can happen in a true public crisis, that I think that the press has to keep things in perspective. That's critical.
Thank you very much, Mark Penn. If anyone's interested in more data from Mark Penn and the Harris poll, you can go to harrispoll.com preparedness.com. They're going to continue to be in the field throughout this crisis just to measure how people are thinking about this and reacting to it. And given that there was that big of a swing in a couple of days, you can expect that as more and more people are affected by this, you're going to see even bigger swings. We're going to have a quick message from our sponsor, Bank of America, who we're deeply thankful to for helping bring this to you. We're live streaming this across different platforms on Axios.com, and we're able to do that because of sponsors like Bank of America.
We have the power
to make a difference
right now.
We have the power to make sure everyone has clean water.
To provide access to education for all.
to rid the world of AIDS
once and for all.
We have the power
to choose to include.
To create clean energy.
To raise capital.
And be fearless entrepreneurs.
To understand different perspectives.
We stand behind all our partners working to make a difference. What would you like the power to do?
Thank you for sticking with us. Sarah and I are going to dig a little deeper into this. I got a question right before I was coming on from one of our readers who feels like sometimes the coverage is just too hyperbolic. You're making it seem like doomsday, when in fact we don't actually know how it will unfold, which is true. We don't really know how it will unfold. I guess the way that I look at it is we do know how it's unfolding in Italy, how it unfolded in parts of China, and we're seeing what's happening in the Seattle, Washington State area, and you can start to extrapolate if you apply that across the country. I think that's what makes a lot of us who are knee-deep and kind of marinating in this coverage nervous. How do you think about it?
I think that reporters have an obligation to be able to tell people things through a data-driven and clinical lens. And so people might say, hey, this feels overcovered. But at the end of the day, what the data is showing us, Jim, is that in fact most people are not taking this seriously enough. We're seeing cases of people, especially young people, going out of their homes, going to beaches, not really thinking about what the impact is going to be of their presence potentially spreading that virus. And so when people say to you, hey, this coverage seems overblown, it's really not. It's really up to us to make sure that we're telling the story, that we're using data to inform it, and that we're doing it to keep the public and to keep our readers safe.
And you see this with the number of companies, number of industries that are worried about going under. We had this fascinating study today from Moody's, which studies sort of the economy, and you look at the high-risk industries, and then you look at the number of industries that are looking for bailouts. Companies don't just look for bailouts because they want to get free government cash. Certainly some do, but they do it because they're really, really nervous. They're looking at the booking rates, or how many people are flying, or how many people are eating out. And the number of industries that are at risk, not just the obvious ones. Obviously, airlines are at the top of mind, but even our friend Dylan Byers over at NBC had an interesting item this morning about how just traditional different parts of TV could be in trouble because they're so reliant on live sports. Well, we're in a world with no live sports. And so the economic consequences, they're set in motion. You can't pull them back. When JP Morgan is saying, listen, you could have negative 15% growth in this quarter, that takes a long time to recover from. That's not hyperbolic, that's real.
It's totally real. And when you have government officials, as they did this week, alluding to the fact that this might not be a recession, it might be a depression, something that we haven't seen in a century. And so when we're talking about those economic impacts, let's drill down a little bit into that Moody's survey. Of course, we know airlines are going to be impacted, but this survey finds things that you wouldn't even thinking about are going to be hugely impacted. Take a look at mining. Mining is a situation where you have people in close quarters. Of course, people are not going to be going to work if they feel like they could contract the virus in those close quarters. Things like manufacturing, of course, local restaurants and retail. Every sector of the economy is going to be touched by this. And I think one thing that from the Harris poll, what we were talking about earlier, that we need to be thinking about as a country is how can we ensure that not the wealthy and well-off are the people that are going to be able to get through this. I worry that some of the people in these sectors, people who can't work remotely, right? If you're a server at a restaurant, you can't use a Zoom video chat to work remotely. I wonder how this is going to impact them.
And just basic healthcare, there's not great healthcare services in a lot of these communities, a lot of these areas, and I think that is what's going to get hit hardest. Bill Gates had a very smart conversation on Reddit. He was the founder of Microsoft, but he's dedicated billions of dollars to studying virus and disease, and he was saying we might get through this in 3 months, but then it'll hit Africa and hit other areas where They just don't have the same services that we do. And like we live this very real here. I try to look at it as a small business owner, right? We're collectively owners of Axios. We have 200 employees. There's no doubt that companies will pull back on advertising. Like we've already frozen tons of open slots that we have. Like our job is to protect the workers that we have here, which is the job of most businesses. But if every business will pull back, that's what people don't realize. And one thought experiment to do, I did the other day as I was driving around, just look at everything that you're doing, look at everything you're seeing, and ask yourself, will that be possible 2 weeks from now? Because we haven't hit the peak, and that's the reason I think that you still see people partying stupidly in Florida, is because we haven't hit the peak. People haven't seen how bad it'll get. Truth is, we don't know how bad it'll get. I think in 2 weeks, we'll have a pretty good sense of how bad it can get.
Yeah, I mean, if you listen to Governor Cuomo in New York, he says that New York will hit its peak, he predicts, in 45 days from now, which means that we are a long road away from a full recovery here. I'm wondering for you, as somebody who does run a small business, who's a leader, how are you communicating effectively with your employees to ensure that there's no panic amongst them and that they continue to work, albeit remotely, even when there's crisis, even when they potentially have to take care of kids at home because school is out? What are you doing to address that?
I think all of us, our teachers are dealing with this, parents are dealing with this, people running businesses are dealing with this. I think the acronym WFH, right, will be as common as the NFL or as HBO in terms of their frequency of use, because everyone's going to be working from home potentially for many, many months. And all you can do, I think anybody who's in a leadership position, Mark Penn talked a little bit about this, is you have to be super clear in your communications each and every day. You have to explain the reality of it. You don't want to scare people, but people are adults. They also have to understand that this is going to have real consequences. And yes, like it sucks. Like people have to juggle really tough situations. There's a reason most people don't homeschool. It's really freaking hard, right? And so now everybody is a homeschooler while trying to be able to do your job. That's a lot to ask of people. And like this is, I think one of the good things that will come out of this, and it's hard to be optimistic, one of the good things is like, it does, like as I think about Axios as a family, like we're working more closely together than ever before. I think communities are gonna have to work more closely than ever before. And I think the American public that's grown cynical about politics, about governance, this is why this stuff matters, folks. Like we've been saying this forever. It's why if you don't have the right people in the right place at the right time with the right amount of trust, you can be screwed. You really, really can. And you see that. Like it's taking the president a good month to be able to catch up and be able to get people to trust him again. We need people to trust him. We need people in the right spots to be able to make really good decisions. And I think this is a moment. This is a moment for anybody in a position of power. Whether your position of power is you're helping run a household, helping run a company, or helping run a country, to rise to the moment. Like there's going to be a very Darwinian dimension to this, right? Not just health-wise, like the healthy will be able to survive a lot if they're infected with the virus. There'll be a Darwinian dimension to businesses, to any organization. If you're not strong, if you're not smart, 3 months without business, will you survive? Like these are a real gut check for America.
Mm-hmm. We've been covering this presidency, this White House for many years now. You've covered many presidencies. I think one of the problems that we're having in the trust crisis is that this administration has done a lot to undermine trust of key institutions, whether they were institutions within his own administration or they be the media or local officials. Now he needs that trust. So do you think he's going to be able to tap into that to regain that trust of those, the media that he's been bashing for years, or is it a little too late?
Listen, we've been talking about this a lot at Axios for the last couple of years, and I'm telling people, like, politics isn't a joke. It's not a joke, and the media is not a joke. Like, there's things you can critique about these things, but when you start playing with trust, when you start teaching a society to not believe what it sees, in a case of emergency, you'll have chaos, and we have to restore that. And you do see a lot of governors, mayors, you even see the White House now stepping up and sort of speaking at least with mostly one common voice. I get tons of emails from people saying, it's overblown, it's overblown. It's not overblown. Like, hopefully it only lasts a couple months. But if you're one of the people sitting here watching this saying, there's not that much to fear, you've got to look at the facts. You've got to be able to look at stuff that you trust and start to make really smart decisions about what you're doing personally, what you're doing for your finances, what you're doing for your workplace. So I appreciate this awesome conversation with you, Sarah. We're going to have one more break from our partners at Bank of America. After that, you're going to hear from Mike Allen, who I think is the most wired reporter in the history of the galaxy, talking with Caitlin Owens, who covers the politics and policy of the virus and has been writes a Vitals newsletter, which you could sign up for. Just really, really smart, again, very clinical in her coverage, who can help you understand what the Washington response might be. Thank you.
Welcome back to our first Axios virtual event. I'm Mike Allen, a co-founder of Axios. We appreciate Bank of America for making this conversation possible. Thank you for joining us today, and we hope that you, your family, your colleagues are staying as safe as you can. I'm here with Caitlin Owens, who covers healthcare for Axios, does the Vitals newsletter every morning in Chapel Hill, graduate. And Caitlin, our colleague Dan Primack, said that local nurses in Boston, where he works, have been going on Facebook begging for masks and are so grateful when people donate them. How did we get here?
The demand for masks right now is unprecedented. And, we're not talking just about, the face masks that you see, the common, what everyone thinks of masks. We're talking about heavy-duty masks.
That save your life.
That save your life. So the issue right here is that healthcare workers are our best line of defense against this virus. People are going to need medical care. Most of them won't, according to the statistics we've seen. But there are people who are going to need to go to the hospital and receive treatment. They will be in critical condition. And if our healthcare workers are exposed to that virus, think of it as kind of a domino effect. The health workers go down, the healthcare workforce is decreased, the less people they can help, and the cycle continues. And that would be a nearing worst case scenario. So the masks are critical to protecting these workers.
And there's stories today about healthcare workers needing swabs, needing all kinds of supplies, and this has to be a reason that a lot of our healthcare professionals are getting sick. So if I'm looking ahead, we can see what's covering in the country. As Jim said, you look at China, look at Italy, that's going to be, that's the risk for us. What do we do if all our healthcare workers get sick?
That would be a bad scenario. So I think where we are right now is that we need to figure out a way to keep them from being sick. We need to do everything we can to make sure that they have that personal protective gear that they need. So those would be masks. It's not just masks, though. It's also gloves, gowns, anything to keep them from coming directly in contact with this virus as they treat patients needs to be our critical focus right now. There are desperate measures. I was reading the CDC's website this morning, and they're saying that if no masks are available, this is unproven, but you can use bandanas or scarves as a healthcare professional to try to protect yourself. We need to avoid getting there, and that involves manufacturing, because the problem is that other countries are experiencing the same thing that we are. So we can't, most likely, the signs are we should not count on being able to import our way out of this from other countries. And so that's why the president invoked the Defense Production Act yesterday. We don't know what he's going to do with it yet. But that gives the federal government extraordinary powers to kind of redirect manufacturing in the country. TBD if and when and what he does with that. But I think that's what the conversation is today. We need to figure out how we are going to escalate those supply productions.
Well, much of America is working from home or even sheltering in place, as they've talked about in the Bay Area and in New York. A lot of America is heroically going to work. There are people, especially in small businesses. Headline on the front page of the New York Times business section today: I'm scared to go to work.
Right.
What's some practical advice for people who have to go about their daily life or are trying to keep a business going?
I mean, this is where personal hygiene comes in. You know, as all the healthcare professionals keep saying, if you do go out, regardless of whether it's to work or wherever, don't touch your face, wash your hands, make sure you have, Clorox wipes, disinfectant to wipe down surfaces that you may be touching. But kind of these general, social distancing, stay 6 feet away from people. If you have to cough into your elbow, not your hands. Don't shake hands, don't touch others. So these basic personal hygiene and social distancing measures can go a long way. But again, it's serious. If you don't need to leave the house, don't leave the house.
Caitlin, in Vitals, your morning newsletter, which has been so great on this, you've been talking about the race for a vaccine. Now, we watch the briefings. They say at least 18 months away. Does that mean 18 months we could have one? What's the latest intel from your reporting?
Yeah, I don't think that we should count on having a vaccine until next year, at the very earliest. It's not like we can just predict how this is going to happen, but there are a lot of drug companies that are racing to develop this. And until then, all we can do is continue what we're doing now with kind of mitigation and social distancing efforts. In terms of treatments, there are experimental treatments, experimental trials going underway for drugs to treat the virus. So those could eventually help with the symptoms and helping those who already have caught it. But again, right now, these things aren't guaranteed. And while drug companies are racing to work on them, that's why we have to take these mitigation efforts so seriously, because there are no guarantees and there are no concrete timelines right now.
And across the scope of your reporting, from senators to people who work in the healthcare field to the health policy field, what are you hearing behind the scenes? Take us inside your texts, your emails. What's the obsession of the people in your world?
I will say, no one has been as busy. It's kind of it reminds me of the word triage comes up a lot. You're dealing with problems as they come and kind of taking you're prioritizing things as they come. It's kind of, as we move on through this crisis, it's one problem after the other, one thing to solve after another. And people are just kind of, it's unprecedented. And I don't think that people have a real roadmap of how to do this. There's plans and whatnot, but I think we've seen from the federal government's response, we were caught flat-footed on this. People underestimated it. We didn't know what we were in for, the administration in particular. And so I think that now I'm watching everyone play catch up.
And you spend a lot of time on the Hill. A lot of times I'll see you waiting by the elevator, looking to catch senators. As you talk to people on the Hill now, do they feel like they're behind? Do they feel like they're getting in the game? What's the trajectory of their mood, their feng shui?
I would say it's anxious. I think that they're moving. I think what you're seeing now is Congress is working on its third package to address the virus. Congress doesn't work together very well these days. So I think that is just reflective of the urgency of the situation. It's also becoming very personal for lawmakers. Last night, we had the second lawmaker announce that they had been diagnosed with coronavirus. And so they're not isolated from this emergency either.
And Caitlin, we're about to get the hook here, so I have to ask you quickly about some of the dystopian scenes that we're seeing. Our colleague Dan Primack said that he went to the hospital to pick up a friend who was getting something unrelated, and there were cops with masks who were making sure people went into the right door. Sarah Fisher, who we just heard from, both of her parents are doctors. In the parking lot of their hospital, there are tents. Seattle Times on the front lines today with a story about pitching tents on a soccer field. Where do you think we're headed for healthcare in America in the next couple weeks?
What is going to happen almost inevitably is we're going to see a spike in cases soon in the next few days, especially as we're kind of seeing the virus catch up to our social distancing efforts. People who may be staying in their home now will eventually fall sick. Some of those people will need hospital care. Right now, the problem is that America's hospitals do not have the beds or the equipment to treat all those people that statistically will need care. That's why you're seeing kind of triage units being set up outside of hospitals and extra beds being set up in kind of random places. We need more of that. We need to make sure that our healthcare professionals have the space that they need to treat the influx of patients that is projected to come in. That is what we're working on now, and it's particularly important to kind of we're kind of working with without information here. People aren't getting tested, so we don't quite know how bad the problem is going to be. And so I think what we're seeing is, people I talk to, I don't think we're doing enough to prepare. I think we're still a little bit behind on making sure that hospital capacity is built up as best as we can. But yeah, there are going to be extreme measures taking place, and that's because we're expecting an extreme situation.
Caitlin Owens, thank you for your great coverage and for this conversation. Thank all of you for joining the first Axios virtual event. Thank our partners at Bank of America for making it possible. Thank all my Axios colleagues who pulled this off. The events team, which has done this amazing work, Axios Studio, the graphics team, editorial team, all across the company. People are coming together to make sure that the Axios journalism, clinical, trustworthy, worthy of your time, still comes to you. We'd love to have this conversation every morning. Can't necessarily come to you on the YouTube, but we would love to talk to you through our newsletters. Caitlin Owens' newsletters, Vitals, my Axios AM and PM makes you smarter, faster. Signup.axios.com. Signup.axios.com. You can start your day with us. We hope that your family has health and ease, and thank you very much for taking time to join us. See you on Axios.com.